हेलो, माय नेम इज डॉक्टर गोपिका नायर। वेलकम टू आरोग्य फिजिटिप्स। आपका आरोग्य फिजिटिप्स में बहुत बहुत स्वागत है। सो टुडे आई ब्रिंग अ टॉपिक, अ वेरी मोस्ट कॉमन टॉपिक अबाउट लॉस ऑफ or absence of lumbar lordosis, which is, I can say, it's also known as a flat back syndrome. Whenever the curvature, the original curvature is reduced by the particular level, then it is known as a flat back syndrome. So there is a particular level of curvature which should be there in your body. If it is not there in a particular level, then it can leads to any type of syndrome. Now the causes to which all patient, like etiology, who all can get the this type of loss of lumbar lordosis thing. So the patient who are suffering from congenital issues. Congenital means by birth. If you are going through with any type of scoliosis issue, any type of kyphosis issue, that can lead to loss of lumbar lordosis as well. Next, it might be can be possibility of aging. If the age is like too much, like 74, or might be it can be like if the short height issues will be there, or the patient who are suffering with any type of vitamin D deficiency, or any type of bone or any type of calcium disorder, they might can also get this type of loss of lumbar lordosis issue. Now the symptoms, that with the help of symptoms, how you can able to sit in your home and get to know that whether you are suffering from loss of lumbar lordosis or not. So the patient who are suffering from this thing, they unable to stand upright. It might create a difficulty for them. The pain will be there in the neck, in the shoulder, as well as in the back. Because of the back, it can radiate to your legs as well. Whoever is suffering from the same type of issue, they can also face the mobility issue as well. Those people can also feel fatigue a lot, and most common, the posture of them is stoop. So if you didn't bother about, if you're going with the loss of lumbar lordosis, then you might can lead to the worsen condition, in the sense stoop posture. Your shoulder is completely like this, and your neck will go forward like this. So this might also can create a loss of lumbar lordosis, and if you didn't bother about that also, day by day it will worsen like anything, and it can leads to any other disorder which can't like which we can't able to get back to the position as well. So make sure go with the symptoms and check yourself and get back to us. So there is a diagnostic thing where you can able to realize that yeah, we are going through particularly loss of lumbar lordosis. Not with the help of symptoms, you can correctly, you can at least partially get to know that whether you're going with the lumbar lordosis, loss of lumbar lordosis. But the diagnostic thing is with the help of medical with medical examinations, physical examination. With the help of that, the doctors can able to tell you you're going with the loss of lumbar lordosis, or else there is a x-ray. With the help of order of x-ray, or we can say a CT scan, MRI, with the help of that we can clearly identify whether you're going with the loss of lumbar lordosis or not. Okay. Now there is some complication which you have to make sure. If you didn't get to know that whether you're going, some of the patient never ever realize they're getting the pain or nothing will be there, but still they having going through with the loss of lumbar lordosis. So in that condition, if you didn't even bother about that, that might can aggravate like anything, and that can leads to postural imbalance. So make sure if you're going with any of the loss of lumbar lordosis, or anything like you feel like my curvature is different, little bit like different in the sense, comparing with other people, if you get to know it's very much different to them, so you can check with the symptoms, you can check with the diagnostic thing, and you can go with the doctor, consult them, and get back to us. So after all this evaluation and symptoms, with the help of that, if you got to know that you are going through this with the loss of lumbar lordosis, there is no need to go with the surgery. Okay, there is a exercise. With the help of exercise and stretching, you can cure that with yourself in your home, sitting in your home. You seeing this video, you can go with the exercise and just perform those exercise in proper manner, the way I'm teaching you in this video. First exercise, breathe in crawling position. Don't create this arch, should be neutral. Just blow out from your mouth and try to make a hump, and just breathe in and back neutral. Not at all cat we have to do, only camel position we have to perform. Breathe in, blow out, breathe in, make your back neutral. Try to hold for a while and then relax. Next, same crawling position you have to be there. Take your knee towards your upper direction like a donkey kicking. Don't try to straight. Just you have to fold your knee, push yourself up and down. Make sure your back should not create the arch. It should be straight as neutral. Try to repeat at least 10 times and then back to normal. Next, lay down. In that, knee towards your chest you have to bring. Try to keep other leg straight, and then down. Breathe in, knee towards your chest, blow out from your mouth, and down. Try to hold it for a while and then relax. So you have to repeat this at least 10 repetition you have to do. Gradually you can increase your repetition. Next exercise, in that lay down position, you have to lift your hip up, fold your knee, other side of the knee folded, and try to kick and come back. Try to kick and come back. Maintain the position like this, same. Sustain hip bridging, kick and come back, kick and come back. After maintaining this much, if you are getting any pain, then you can keep your hip down and again lift it up and again perform the same exercise. Or else, if you are not getting, then you can continue the movement as much as you can do. Next, this is the Lordotica which you are doing. No, you have to create the posture back. Try to make it straight. Hold the position for a while, legs apart, and then relax. Next, kneel standing position. Same, one leg forward. Try to hold your hands and move your pelvic forward, backward, forward, backward. If you are not able to get, then you can hold your thumb over there and move your pelvic forward and backward. Next, in same kneel standing position, try to push your leg forward and backward. In both direction, you have to keep leg folded and forward and backward. You need to give a stretch and back to normal. If you're not able to balance, you can keep your hands straight. Same position, kneel standing position, you have to sit and maintain this position for a while. Hold it for 30 seconds at least and get back to normal. Lay down on your tummy, try to lift your leg up straight without folding your knee, and both hands should be under your chin so it create a good arch. Next, you have to do the child pose, in which you have to create a stretch. Don't try to lift your hip up, try to sit on your foot and just stretch yourself, hold it for a while and relax. Next, lay down on your back, try to lift your hip up and down, lift up and down, just like a bridging which you have to do, a normal bridging, and down and relax. Next, you have to fold your knee and butterfly position. Try to touch the feet together. Slide your hands both together down as the lumbar lordosis curvature is lost. For create that purpose, you have to do the stretch. Slide your hands down and slide up. Slide your hands down and slide up, maintaining the position. Next, you have to sit on the chair. Don't take up support. Just fold your knee and try to touch your hands down completely and hold the position and come up. Try to do it as much as possible. Next, you have to sit in kneeling position with one knee folded, taking support with the help of chair. Hold the position. Try to move if possible for at least 30 seconds. So, whatever exercise right now I taught you, like sitting and standing while on your tummy and stretching, make sure if you're unable to go forward, take any type of pillow, take back support, and then go for the stretching purpose. If you feel like you're doing in some inappropriate way, then please stop immediately. Don't force yourself, because in stretching, if you overstretch it, it might can leads to any type of pain too, because you're already going with the flat back syndrome. So make sure that, and if you have any doubt, please let us know in the comment section. Witness your fitness with us.